मुंबई में हाल ही में एक मेडिकल इवेंट ऑर्गेनाइज किया गया जहां पर सिंगापुर के जाने माने डॉक्टरों ने अपने एक्सपीरियंस को आम लोगों के साथ शेयर किया। इस मेडिकल इवेंट में नजर आए डॉक्टर ली वाई चोंग जो पेशे से किडनी ट्रांसप्लांट के स्पेशलिस्ट है। वहीं साथ ही नजर आए डॉक्टर केरियन लिम जो कि लीवर ट्रांसप्लांट के विशेषज्ञ हैं। इन सभी इंटरनेशनल डॉक्टर्स ने भारत में बढ़ रही किडनी ट्रांसप्लांट और लीवर ट्रांसप्लांट के मुद्दों पर अपनी बातें जनता के सामने जाहिर की। तो आप भी देखिए किस तरह से इन डॉक्टर्स ने पेशेंट्स और आम जनता के सवालों का जवाब दिया।
We are a center. We are a center that specializes in difficult transplants. And that's perhaps why a lot of patients of India comes to us to do a kidney transplant. So we specialize in old patients who have a kidney transplant. We specialize in diabetics. We specialize in patients with heart disease. We specialize in ABO incompatible transplants. We do transplants for patients who have antibodies against the donor, HLA sensitized transplants. So why do we do it? Well, certainly not for the fun of it, but we do it because patients require it. So my first ABO incompatible transplant, which was done in May 2008, was done because if I don't do it, the patient will not survive. That's why I had to do it. And as we do it, we develop our skills in doing it, and then we refine our ways of doing it, and so we get very good results, we get very good outcomes from doing blood group incompatible transplants. Just answered that question. We are trained in Western medicine. So in Western medicine, in Western style of medicine, everything has to be based on research. Every medicine that we used have to be tried and tested and proven to be safe, effective, and free from major side effects. In other words, the drug shouldn't kill the patient, and they should show that it is of good use to the patient. Alright, you may say, and the Chinese patients tell me that too, Ayurvedic medicine has been used for 5,000 years, Chinese medicine has been used for 5,000 years. Now your own doctors, your own local Indian doctors have published articles showing that Ayurvedic medicine has a high content of lead and mercury, and they are potentially toxic to the person. So sometimes we have to keep an open mind. We have to try something that doesn't at least do harm to the patients. So you have to be careful whether you're going to use Ayurvedic medicine or whether you're going to use Western medicine. But at least in Western medicine, we know the benefits and we also know the risks.
Monitoring these things in the newspapers and several social media and all, that increasing number of transplants, so many, that means the rate of increase in this transplant is so high. What are the reason and what is the life of a transplanted kidney?
Well, perhaps it's not because of increasing numbers of people having kidney failure. It's likely because of increased detection of kidney disease. So, if your country doesn't grow economically, then a lot of patients don't see a doctor. A lot of patients don't live long enough. So you wouldn't know that you have kidney disease. As your country grows in affluence, then more patients are diagnosed with kidney failure. More patients live longer to have kidney failure. And that, of course, gives you the perception that there is an increased incidence of kidney failure, patients who require a transplant. But of course, with affluence, you have affluent diseases. You have obesity, you have diabetes, you have more hypertension, and that, of course, leads to increased risk of kidney failure. So there are two things to this issue: increased diagnosis and perhaps an increased number of patients with risk of developing kidney failure. So how long does a kidney transplant last? Every center is going to be different because every center has a different way of doing their transplant, has a different way of treating the patients. I always tell my patients, putting in a new kidney is not buying, it's not exactly like buying a new car, but it's also similar to buying a new car. When you buy a new car, they give you maybe the first 2 years, warranty. After that, you have to service your car. Unfortunately, in kidney transplantation, there is no warranty for the first 2 years. It needs regular servicing. So if you look after your kidneys carefully, we tell the patients, you have a 50% chance that your kidney will last you 15 to 17 years. Unfortunately, at this moment, I tell my patients, no kidney lasts forever. No transplant kidney lasts forever. Amount of transplant medicine, you can't take too little. If you take too little, your own body will reject the kidney. If you take too much, your immune system will become too low and you'll get infections or cancer. So you have to adjust your transplant.
Transplants 20 years back. And I've crossed now 20 years. And where it was done in Singapore. And one of the doctors is sitting here also. I was saved. Now somebody asked me a cost comparison in 99 when I went to Singapore. The cost of in King's College, Roger William, 1 crore of rupee, and no guarantee when the liver transplant will be done. 2 years waiting. I went to Apollo Hospital. I would have been the 5th patient if it was done at that time. 25 lakhs of rupees. Singapore, 70 lakhs of rupees. So that's a cost comparison. I don't know what it is today. Now, as far as life is concerned, I have already told. But a few words for Singapore. Now, if you have to go to Singapore, I think they score over India on a couple of things. Let me be very, because I am myself a medical professional, ex-director of Johnson Johnson Abbott. I am still working 10, 11 hours a day on same field. What they score high, because I have been going now to Gleneagle, Mount Elizabeth, all Parkway Group. Every year I do. So one thing what doctor said is must, the servicing. That means if you look after your whatever transplant every year, once, twice, 3 times, I am very regimental. I keep Singapore informed, now I local doctor informed, and that's the crux of the whole thing. So coming back to the difference, I'm not belittling Indian, because some of our hospitals are very good. Like I go to Kokila Valley now, I find it.
In medicine, I'm an old-fashioned doctor. You cannot set up branches. It is not a business. It's not a restaurant. So you need the quality, you need to be hands-on. The doctor has to be involved. You cannot say, okay, well, even in a restaurant, your celebrity chef comes along, open a restaurant, teaches the chef how to cook. It's not the same as he doing the job. It's not a recipe. You cannot hand down a recipe. So you can't open branches.
So you can visit India. You can visit India for such reasons.
Well, we can visit India. I'm here now. I'm visiting India, but there's no way I can visit India every month. Then my patients will be compromised in Singapore.
Shared was more important than what we can say up here from the podium. It actually takes 2 hands to clap. You need a motivated, responsive, and responsible patient to be in up to date with their medical consultations, to pay attention to any new symptoms, not to ignore potential issues, and to be very proactive, to work with your physicians, your surgeons, and to address any potential problems that come up in a timely fashion. And with that, we can identify, make early diagnosis, institute early treatment. Things like rejection can be sorted out quickly and well, and to adjust immunosuppression, as Dr. Lye mentioned. The further away you go from transplant, we start to proactively manage and tailor each individual person's many medications and to tailor that to that very individual. So it's not a cut and paste. It's a very individualized approach, and I think you can speak to the gentleman later. I'm not going to mention his name for confidentiality, but you can speak to him on the side. I'm sure he'll share with you with a lot of detail, a lot of energy, what it has taken for him to be with us today, 20 years after his liver transplant. And just one slide. So we're all born with healthy livers. Over time, depending on our lifestyles, different factors due to viruses like hepatitis B or C, which can be acquired in various ways, alcohol consumption, fatty liver, other rarer metabolic liver conditions, our livers can become inflamed, and that's detected on a blood test. And if that inflammation is allowed to carry on or goes on undetected, the liver can become scarred, and there's fibrous tissue that can lay down in the liver. If that happens for long enough, the liver then becomes cirrhotic. So the liver, instead of being nice and spongy like you see on the left side, it becomes like a hard rock, and that's known as liver cirrhosis. Once cirrhosis occurs, it's just a waiting game before complications start to arise, and one of the complications is liver cancer. The good news is that the pathway doesn't just go from left to right. If we detect liver inflammation and liver fibrosis at an early stage, there are ways and medications available now that we can arrest as well as reverse the injury. So what are the two most common? There's a long list of causes of liver cirrhosis, but I'll just highlight on two common ones that we see in the clinic in our everyday practice. So number one is hepatitis B. This is affecting 350 million people around the world. 3/4 of that are where we live in Asia. And the most common route of transmission of hepatitis B in Asia is vertical transmission from mother to child. And this is the leading cause of liver cirrhosis and liver cancer in this part of the world.
Because a lot of people think maybe the cause of kidney disease is usually absent. The most common cause of backache is musculoskeletal, the spine and the muscle. Unless you have kidney disease, backache is very rare. The take-home point, if you have been diagnosed with having problems with your kidneys, please do not be complacent. Even though it is just an early kidney problem, you have to look after yourself, especially your blood pressure, so that your kidneys can last you for many, many decades. You see the problem with this. If you don't control your blood pressure and don't look after your kidneys, it can be a difference between a few years to 10 and 20 years. So there is a huge difference. So please be careful, even when you have very mild kidney disease.
So
That's the take-home point.
So one question,
Different doctors are going to think differently. So it's not possible for me to speak for the other doctors. But if you're not happy, then you should go and get your second opinion. I mean, it's your life, it's your kidneys, it's your money. So don't be satisfied. If you don't think your doctor is doing the right thing for you, find another one who does.
when we talk about lifestyle disorders, if you would like to share any experience,
Lifestyle would be, do not be overweight because it makes your blood pressure very hard to control. Try and lose weight. Sensible, healthy diet. That's the recommended lifestyle.
And which are the countries who are providing the best of the facilities when it comes to kidney transplant?
Wow.
Liver transplant? Would you like to, as per any rankings or any studies, research, or maybe out of your experience?
I don't think it's a matter of countries. It's a matter of center experience and the doctors. So if you find the right center and you find the right person who has the experience in doing the transplants, I think that's what matters.
How much awareness do you see globally among the people about when it comes to organ donation?
Well, I think in India there has to be an increased awareness in organ donation. It's growing. It's starting. There is a website, by this lady. She's a donor. Perhaps I could give you her contact and you should talk to her. She is really very aggressive in promoting both deceased and living organ donation because she herself is a donor. She donates. She has donated her kidney to her father. So she's very actively promoting organ donation. I think you all should go and talk to her and help her promote organ donation. That would be very, very helpful to the country.